1. What is the most effective method to prevent the spread of infection in a healthcare setting? Wearing sterile gloves. B. Administering prophylactic antibiotics. C. Performing hand hygiene. D. Isolating all patients. Answer. C. Performing hand hygiene. Rationale. Hand hygiene is the cornerstone of infection prevention per CDC guidelines, removing pathogens effectively. Sterile gloves protect the provider but not the environment. Antibiotics address existing infections, not prevention. Isolating all patients is impractical and unnecessary without evidence of infection. 2. Which precaution is appropriate for a patient with tuberculosis? A. Contact precautions. B. Droplet precautions. C. Airborne precautions. D. Standard precautions. Answer. C. Airborne precautions. Rationale. Tuberculosis spreads via airborne droplets. Airborne precautions, e.g. N95 masks, negative pressure rooms, are required per CDC. Contact and droplet precautions target other pathogens. Standard precautions are baseline but insufficient here. 3. What PPE is essential when caring for a patient with Clostridium difficile? A. Gown and gloves. B. Mask and goggles. C. N95 respirator. D. Shoe covers. Answer. Gown and gloves. Rationale. C. Difficile spreads via contact. Gowns and gloves prevent spore transmission per CDC. Masks and respirators address airborne risks. Shoe covers are not standard unless specified by facility protocol. 4. Which action best reduces the risk of catheter-associated urinary tract infection, CAAD? Changing the catheter daily. B. Ensuring proper insertion technique. C. Using antibiotics prophylactically. D. Increasing fluid intake post-insertion. Answer. B. Ensuring proper insertion technique. Rationale. Proper aseptic technique during insertion prevents CAAD per evidence-based practice. Daily changes increase infection risk. Antibiotics are not preventive. Fluid intake helps but doesn't address insertion. 5. When preparing a sterile field, what is the first step? Open sterile packages. B. Wash hands and don sterile gloves. C. Place sterile drapes. D. Check expiration dates. Answer. B. Wash hands and don sterile gloves. Rationale. Hand hygiene and sterile gloves establish a sterile baseline per aseptic technique guidelines. Checking dates or opening packages comes next. Draping follows glove application. 6. What is the appropriate isolation for a patient with MRSA in an open wound? A. Droplet precautions. B. Contact precautions. C. Airborne precautions. D. Protective isolation. Answer. B. Contact precautions. Rationale. MRSA spreads via contact. Contact precautions, gown, gloves, are required per CDC. Droplet and airborne target other pathogens. Protective isolation is for immunocompromised patients. 7. Which vaccine is recommended for healthcare workers to prevent influenza? A. Tetanus. B. Hepatitis B. C. Influenza. D. MMR. Answer. C. Influenza. Rationale. Annual influenza vaccination protects healthcare workers and patients per WHO guidelines. Other vaccines address different pathogens and are not annual requirements. 8. What should a nurse do after a needle stick injury? A. Continue working. B. Report to occupational health. C. Apply a bandage. D. Ignore if no bleeding. Answer. B. Report to occupational health. Rationale. Immediate reporting initiates post-exposure prophylaxis per OSHA, assessing risk, e.g., HIV, HBV. Continuing or ignoring delays care. A bandage alone is insufficient. 9. Which patient is at highest risk for infection due to immunosuppression? 30-year-old with diabetes, B. 50-year-old post-chemotherapy, C. 70-year-old with hypertension, D. 40-year-old with asthma. Answer, B. 50-year-old post-chemotherapy. Rationale. Chemotherapy suppresses immunity, increasing infection risk per oncology guidelines. Diabetes and hypertension are comorbidities. Asthma has less impact and less severe. 10. What is the best way to educate a family about infection control? A. Provide written handouts. B. Demonstrate proper hand washing. C. Lecture for 30 minutes. D. Assign reading online. Answer, B. Demonstrate proper hand washing. Rationale. Hands-on demonstration enhances understanding and compliance per patient education principles. Handouts or lectures may not engage. Online reading lacks interaction. 11. Which task should a nurse delegate to a nursing assistant regarding infection control? A. Assessing a wound. B. Cleaning a patient room. C. Administering antibiotics. D. Changing isolation precautions. Answer, B. Cleaning a patient room. Rationale. Room cleaning is within a nursing assistant's scope, supporting infection control per delegation guidelines. Other tasks require RN judgment. 12. What is the primary goal of standard precautions? A. Prevent all infections. B. Protect healthcare workers. C. Reduce transmission of pathogens. D. Isolate contagious patients. Answer, C. Reduce transmission of pathogens. Rationale. Standard precautions minimize pathogen spread to all per CDC, not just staff or specific patients. Isolation is a separate strategy. 13. Which cleaning agent is most effective against C. difficile spores? A. Alcohol-based sanitizer. B. Bleach solution. C. Hydrogen peroxide. D. Soap and water. Answer, B. Bleach solution. Rationale. Bleach kills C. difficile spores per CDC. Alcohol and soap are ineffective. Hydrogen peroxide varies in efficacy against spores. 14. What action prevents ventilator-associated pneumonia, VAP? Elevate head of bed to 30 to 45 degrees. B. Increase ventilator settings. C. Use prophylactic antibiotics. D. Change ventilator tubing daily. Answer. Elevate head of bed to 30 to 45 degrees. Rationale. Elevation reduces aspiration risk, a key VAP prevention per guidelines. Antibiotics and tubing changes are not primary preventive measures. 15. When should a nurse remove PPE after caring for an isolated patient? Before leaving the room. B. After documenting care. C. Immediately upon entry. D. After washing hands outside. Answer. Before leaving the room. Rationale. Removing PPE before exiting prevents pathogen spread per isolation protocols. Other timings increase contamination risk. 16. What is the first step after a blood exposure incident? A. Notify supervisor. B. Wash the area with soap and water. C. Apply antiseptic. D. Complete an incident report. Answer. B. Wash the area with soap and water. Rationale. Immediate washing reduces pathogen entry per OSHA. Notifying or reporting follows. Antiseptic is secondary. 17. Which patient placement reduces infection risk for a neutropenic patient? A. Shared room with another patient. B. Private room with positive pressure. C. Private room with HEPA filtration. D. Room with windows open. Answer. C. Private room with HEPA filtration. Rationale. HEPA filtration minimizes airborne pathogens for neutropenic patients per oncology guidelines. Shared or open rooms increase risk. 18. What is the ethical duty regarding infection control education? A. Ensure patient understanding. B. Mandate compliance. C. Limit information to staff. D. Avoid discussing risks. Answer. A. Ensure patient understanding. Rationale. Educating for understanding respects autonomy per ethical standards. Mandating or limiting contradicts patient rights. 19. Which technique ensures sterility during catheter insertion? Wearing clean gloves. B. Using a sterile field. C. Changing gloves midway. D. Using non-sterile drapes. Answer. B. Using a sterile field. Rationale. A sterile field maintains asepsis per catheter guidelines. Clean gloves and non-sterile drapes breach sterility. Changing gloves mid-procedure is unnecessary. 20. What action best prevents central line-associated bloodstream infection, CLABSI? A. Daily line changes. B. Adhering to insertion bundle. C. Using heparin flushes. D. Limiting dressing checks. Answer. B. Adhering to insertion bundle. Rationale. Insertion bundles, e.g., hand hygiene, chlorhexidine, prevent CLABSI per CDC. Daily changes or limited checks increase risk. 21. Which precaution is used for a patient with pertussis? A. Contact precautions. B. Droplet precautions. C. Airborne precautions. D. Standard precautions. Answer. B. Droplet precautions. Rationale. Pertussis spreads via droplets. Masks and spatial separation are required per CDC. Other precautions target different pathogens. 22. What is the correct hand hygiene method before donning gloves? Use alcohol-based sanitizer. B. Wash with soap and water for 40 seconds. C. Wipe hands with a cloth. D. Apply lotion first. Answer. B. Wash with soap and water for 40 seconds. Rationale. 40 to 60 second washing removes pathogens per WHO. Sanitizer is secondary. Cloth or lotion compromises hygiene. 23. Which patient is most at risk for HAAD? 25-year-old post-surgery. B. 60-year-old with diabetes. C. 45-year-old with a urinary catheter. D. 30-year-old healthy adult. Answer. C. 45-year-old with a urinary catheter. Rationale. Catheters increase HAI risk, e.g. COTI, per evidence. Other conditions are risk factors but less direct. 24. What should a nurse do if a sterile glove is punctured during a procedure? A. Continue with care. B. Remove and replace gloves. C. Apply a sterile bandage. D. Notify the supervisor. Answer. B. Remove and replace gloves. Rationale. Punctured gloves breach sterility. Replacement maintains asepsis per surgical guidelines. Other actions delay correction. 25. Which isolation sign indicates a need for a gown and gloves? A. Enteric precautions. B. Protective isolation. C. Droplet precautions. D. Airborne precautions. Answer: enteric precautions. Rationale: enteric precautions, e.g. C. difficile, require gown and gloves for contact transmission per CDC. Others have different PPE. 26. What is the post-exposure prophylaxis for HBV exposure? A. Antiviral therapy. B. Hepatitis B vaccine and HBIG. C. Antibiotics. D. Observation only. Answer: B. Hepatitis B vaccine and HBIG. Rationale: vaccine and HBIG prevent HBV post-exposure per CDC. Antivirals are for treatment. Observation is insufficient. 27. Which cleaning frequency is ideal for high-touch surfaces? A. Weekly. B. Daily. C. After each patient use. D. Monthly. Answer: C. After each patient use. Rationale: high-touch surfaces, e.g. bed rails, require cleaning after use to prevent pathogen spread per infection control standards. 28. What is the priority for a patient with a suspected MRSA infection? Start antibiotics. B. Isolate the patient. C. Order a chest X-ray. D. Administer fluids. Answer: B. Isolate the patient. Rationale: isolation prevents spread per CDC. Antibiotics follow diagnosis. X-ray and fluids address symptoms, not source control. 29. Which action best educates staff on infection control? A. Monthly emails. B. Hands-on training sessions. C. Annual review. D. Poster displays. Answer: B. Hands-on training sessions. Rationale: interactive training enhances skill retention per adult learning principles. Emails or posters are passive. Annual reviews are infrequent. 30. What is the correct sequence for donning PPE? A. Gown, mask, gloves. B. Gloves, gown, mask. C. Mask, gown, gloves. D. Gloves, mask, gown. Answer: gown, mask, gloves. Rationale: this sequence per CDC minimizes contamination. Gloves last to protect hands after other PPE is secured. 31. Which patient requires droplet precautions? A. Patient with pneumonia. B. Patient with HIV. C. Patient with shingles. D. Patient with meningitis. Answer: D. Patient with meningitis. Rationale: bacterial meningitis spreads via droplets. Masks and distance are required per CDC. Other conditions use different precautions. 32. What is the best way to prevent VAP in ICU patients? A. Oral care with chlorhexidine. B. Frequent suctioning. C. Sedation reduction. D. Daily X-rays. Answer: A. Oral care with chlorhexidine. Rationale: oral care reduces VAP risk per ICU guidelines. Suctioning and sedation address symptoms. X-rays are diagnostic. 33. Which PPE removal step is correct? A. Remove gloves first. B. Remove mask last. C. Remove gown before gloves. D. Wash hands after removal. Answer: D. Wash hands after removal. Rationale: hand hygiene after PPE removal prevents contamination per CDC. Other steps increase risk if reversed. 34. What action prevents CLABSI during dressing changes? A. Use sterile technique. B. Change dressing weekly. C. Use clean gloves. D. Limit site checks. Answer: Use sterile technique. Rationale. Sterile technique prevents CLABSI per CDC. Weekly changes or clean gloves increase risk. Frequent checks are needed. 35. Which patient education topic is critical for infection control? A. In medication schedules. B. Hand washing technique. C. Exercise routines. D. Dietary preferences. Answer. B. Hand washing technique. Rationale. Hand washing prevents infection spread per patient education standards. Other topics are secondary to infection control. 36. What is the priority after a biohazard spill? A. Clean with alcohol. B. Evacuate the area. C. Use a spill kit. D. Notify housekeeping. Answer. C. Use a spill kit. Rationale. Spill kits contain agents to neutralize biohazards per OSHA. Evacuation or notification follows. Alcohol is insufficient. 37. Which action best protects an immunocompromised patient? A. Limit visitors. B. Use standard precautions. C. Administer vaccines. D. Encourage group activities. Answer. A. Limit visitors. Rationale. Limiting visitors reduces pathogen exposure per oncology guidelines. Vaccines are preventive. Group activities increase risk. 38. What should a nurse do if a patient refuses isolation? A. Enforce compliance. B. Explain benefits and assess concerns. C. Document refusal only. D. Ignore the refusal. Answer. B. Explain benefits and assess concerns. Rationale. Education respects autonomy per ethics. Forcing or ignoring violates rights. Documentation alone doesn't address the issue. 39. Which guideline informs current infection control practices? ANA standards. B. CDC recommendations. C. HCAHO policies. D. State nursing laws. Answer. B. CDC recommendations. Rationale. CDC provides evidence-based infection control guidance. Other sources complement but don't supersede CDC. 40. What is the best response to a staff member with a contagious rash? Allow work with gloves. B. Send home and report. C. Treat with ointment. D. Assign to isolation duties. Answer. B. Send home and report. Rationale. Contagious rashes require removal from work per OSHA. Treatment or reassignment doesn't prevent spread.